Not necessarily. So we would say like a general overall balanced diet, so people can still eat red meat. That's often a question that patients ask, oh, does eating a large consumption of red meat cause cancer? And the answer is to that is no. So we would just say a general normal diet of fruit and vegetables, and making sure that they get their dairy as well, so their calcium and their whole grains and their meat, so their chicken or their vegetables, or if they're vegetarian, their TVP, their textured vegetable protein. So no, they wouldn't have a specific diet. It's often something that people ask. Sometimes patients can take like an extra multivitamin, like for example, a Centrum, not promoting that brand, but just to always check with their pharmacy first, and that it doesn't interact with their chemo. So for example, patients can take up to, I think, a gram of vitamin C a day, but nothing higher, because that can have, like chemotherapy is different and it can affect them as well. And then diets are very individual, depending on the type of disease that a patient might have. So, for example, a patient with head and neck cancer or esophageal cancer may not be able to physically chew and swallow their food anymore. So they may need to be seen by a speech and language therapist if they have difficulty swallowing. It's good to anticipate, for nurses to know this and anticipate this in their patient group. Or just giving them general advice on like soft mashed foods that they can eat, and supplements as well. So nutritional supplements are big in the cancer field, in the group of cancer patients. Yeah, so it depends on the disease, the nature of the disease that the patient has.